So welcome everyone. This is Lisa Zarda. So she is the Executive Director for the United States Swim School Association. Her career in association management spans over 20 years and includes receiving her certified association executive designation in 2010. She has been married for over 15 years and has a 10-year-old daughter and a 7-year-old son that keeps her on her toes. When there's some downtime, she enjoys watching football, traveling, especially to the beaches, and spending time with her family in Cave Creek, Arizona. So thank you, Lisa, for being here today, and we look forward to hearing what you have to share.
Great. Thank you, Livy. I'm so happy to be here. It's great to be with all of you. And speaking of that, and I'm happy to see that many of you have been using the chat, I would love to have you pipe in the chat and let me know what type of organization are you with. I know a lot of what I'll be going over today is probably not news to you. Many of you know this. But I hopefully will be able to present it in a way that you'll see how we were able to take that background and the knowledge, the expertise that we all have, and use that to educate legislators and decision makers. So exciting. We've got a couple swim schools here, social service healthcare, Boys and Girls Club, excellent. Parks and Rec. Okay, good to know. Good to know. I like seeing the diverse backgrounds. So I'm going to go ahead and get started. And where is the best place to start? But back to the very basics and the good old dictionary. So we're going to talk a lot today about being essential and how learning to swim is essential. Obviously, that word essential has become synonymous, I think, with 2020. But the definition is it's absolutely necessary and extremely important. So something I think important to keep in mind as we move forward. And, you know, when all of this started with COVID and things started closing down, but yet there were certain businesses that were deemed essential, you know, one of the first questions that came up was, well, who gets to decide what's essential? So interestingly enough, there is an association for the governors, and you'll see on a lot of my slides, I did try to include the links. So if you wanted to, you know, get some further reference on where I got this information, but each state separately determined what was essential. A few of them went with what the federal guidance was. Those are the ones in blue. A few had no guidance on what was essential. Those are orange. And then there were states that created their own guidance, Florida being one of them. And interestingly, as I took a look at the definitions of what was essential in Florida, swimming was identified, although it was definitely more in the recreational activities area. So it's on there as swimming recreationally, but not necessarily learning to swim. So I work for, as mentioned before, the United States Swim School Association. It is an organization of privately owned swim schools across the country. We even have a few international members as well. And early on, we had a group of members from California that were very concerned because I'm sure, as many of you are aware, they are definitely very strict in many of their state laws, and in some cases have laws that only their state has. And so as they were all being shut down, they were very concerned with what that meant for when they could reopen. So what we did is we actually started, there we go, oop, went too fast. They started meeting weekly as a group all the way back in April of last year. And I put together this timeline just to show you, if anything, to me, this shows be patient. It takes, you know, a lot of time and effort and patience to get something done, especially when you're dealing with, government officials and legislatures. So they started meeting in April, did a lot of grassroots efforts, which I'll touch on here in a moment. In September, towards the end of September, is when they as a group decided to engage CCCSH, and I'll be referencing and explaining exactly who they are here in just a moment. But involving that group is actually, I think, the piece that was pivotal in getting them to the goal, which was to get swim lessons deemed essential in California, which happened in December of last year. And one thing I do want to also add as we go through this, I also recognize, things may feel and seem and are getting more back to whatever that normal is. But this is still important. I think, if anything, this pandemic has shown that things can happen and we should do our best to try to be prepared. And so this, even though things may seem to be opening up, I think there's still some value in looking at pursuing this for a future, hopefully. I keep hanging my hat on this as a 100-year occurrence, so hopefully you won't need it for another 100 years. But still good to show the importance of learning to swim and elevate both the industry and that important drowning prevention message. So here's some of the early activities we did as a group in California, as I mentioned, being a lot more grassroots. So we met every Tuesday, every week, and then we also enlisted other organizations, including NDPA, the California Pool and Spa Association. They created a letter writing campaign explaining the public health need to open swim schools and learn to swim programs. They created a separate Facebook page just for their group to communicate on what was going on, even in between those weekly meetings, or if someone found an interesting news article or other information that was relevant to what we were trying to accomplish. We together wrote an open letter to the health department requesting essential status for Learn to Swim. We had it signed by all of the California schools. And then we wrote to local health departments again. We also asked vendors, charity organizations, basically anyone else that had an interest in the swim school and Learn to Swim industry to help chime in and share the importance of learning to swim. But as I mentioned before, really the pivotal piece was when we were introduced to the California Coalition for Children's Safety and Health, CCCSH. This California Coalition, it is a nonprofit organization, and it's been in California for more than 25 years. Actually, in speaking with them, it sounds like there were a number of states that had a very similar coalition. It may have been started with some government funding, from my understanding, but then when the government funding ran out, a lot of states discontinued it, but California kept it on and found some other ways to help fund it. But its broad core purpose is to sponsor and support efforts to ensure that all California children and youth are healthy, safe from harm, and are able to grow up to reach their full potential. So what does this mean? They will lobby and work on like the seatbelt laws and also obviously water safety. Also, I guess they also have a big issue in California with children falling out of open windows or unsecure windows. So there's a lot of different, it's all about the unintentional injury portion. One thing though that was great is because they were in that realm of unintentional injury prevention, they were very familiar with water safety and with a lot of the data that's out there about drowning being the #1 cause of unintentional death for children 4 and under, and a leading cause for all kids. So that was great in that we didn't have to further educate this group on our mission and what we were trying to accomplish. They got it and they understood it. But one of the keys was this particular organization is actually run by a registered lobbyist. So it was actually an interesting way for us in California to basically engage with a lobbyist, someone who already had those connections, knew exactly who the decision makers were, knew how to get an appointment with them, to get in front of them, to present the information that we wanted to share. And so if you remember back to the timeline, we started working with them at the end of September, and by December, we were successful in getting Learning to Swim deemed essential. And I do credit working with this organization and having a lobbyist as being a pivotal part of that. Because again, you saw we had been starting since April, sending letters, trying to get the attention of government officials, and it was just getting lost. It was getting lost in everybody that was trying to say we need to be open. So this is the official language that we were able to get within the stay at home except for essential needs section on the California COVID-19 website, saying drowning prevention classes, including swim lessons with certified instructors, are permitted in indoor and outdoor swimming pools in all tiers as they are deemed essential. So of course we were thrilled to get this in place. It of course added some additional questions of, well, what does that mean as far as COVID protocols and all of that? I will, however, also add the caveat that while the state did put this out there, we still had challenges with 2 counties and 2 county health directors that took a more strict approach in all aspects, not just in Learn to Swim, and decided they didn't agree with this essential designation. And so work had to continue to try to educate those public health officials on the reasons why we were deemed essential. So next I will cover that. Like I said, a lot of this is stuff that you guys are going to be very familiar with. I think the big point here is, and this is something that the lobbyists continued to tell us, is that you guys are the experts. It became apparent to me in working with and trying to communicate with those decision makers that were deciding this, is that they had a very specific and limited view of Learning to Swim. And it was probably mostly based on their own experience, whether they sent their kids to some lessons, or maybe they remember their lessons when they were a child, or maybe they didn't even know how to swim. So it was our job, and that's one thing that the lobbyists kept reminding us, it was our job to educate and make sure that they understood why Learning to Swim was essential and why drowning prevention was just as important as COVID because of its potential risks and harm to the community. So the points that we stuck with most closely when trying to communicate were these points: that formal swim lessons between the ages of 1 and 4 can help reduce the risk of drowning by 88%, that drowning is the #1 cause of unintentional injury death for children ages 1 to 4, and a leading cause for young people 14 and under, that the risk of drowning is a public health risk, and childhood established swim skills is one of the integral drowning prevention strategies. Now, and we're always very conscious of the fact that, yes, there are definitely a need for layers of protection. In this case, we were really putting focus on the Learn to Swim piece because that was the piece that we were trying with this particular effort to move forward. Although I think we always still made it a point when we're talking about Learning to Swim to say this is one of the layers of protection or one of many important drowning prevention strategies. We also pointed out the American Academy of Pediatrics recommends that all children learn to swim as early as age 1. I'm sure many of you are familiar, but that the American Academy of Pediatrics updated their stance, I think it was about 2 years ago now, to start as early as age 1. and that removing access to water, safety, and swim lessons inherently puts children more at risk of drowning. And honestly, that's something, we think we're still yet to see the ramifications of all of this. I'll add here, interestingly enough, I did a survey with our members just last month saying, hey, it's been a year. What's been the impact that COVID and the closures and the restrictions has had on your business? And I'm pretty alarmed to see, and this is the very low end estimate because not everyone even filled out the survey. And I also know that, we were just looking at privately owned swim schools. So this does not include YMCA programs and all of that. But we asked, how many kids were you teaching to swim prior to COVID? And how many are you teaching now? The number was over 77,000 kids that are not getting lessons that were just a year ago. And like I said, that is a very small slice of the whole pie. So there are a lot of kids out there not getting swim lessons and still aren't. And that's very, very disconcerting. We've also seen an increase in folks that got backyard pools over COVID. They weren't going on vacation. They had nothing else to do. So they built a pool in their backyard, which is, obviously we all love the water, but did they get the drowning prevention education along with that? There's, more water out there. So the potential will increase. So we're closely trying to monitor some of the drowning prevention numbers, and I'll touch on that a little bit later, some of those numbers to see, but logic would say that we're going to see an increase in drownings going forward, which we're really trying to continue to work and kind of make up for that gap in education as much as we can. So understanding that learning to swim is obviously essential, and it in a very important piece in the puzzle of trying to prevent drowning prevention, which obviously has very high risks for young children. What about COVID? We obviously know when, talking with government officials at the time that we could not ignore that piece because it was important. And we made sure even in our letters to communicate that we understand the need to try to mitigate COVID as well. But as we dug deeper and talked to some industry experts, we found some interesting information, which I'm going to share. Again, many of you may already know this, but there may be a few new pieces in here that you weren't aware of, because I know as I was going through and talking with experts there, we uncovered some really interesting information I had not heard before. One important piece is that indoor pools have been operating and doing so without an outbreak of COVID. We've continually surveyed our members throughout this past year, and we were finding that COVID was not being traced back to swim schools. What was happening if there was COVID in a school, it came from outside, whether it was the person had been at a family party, or maybe they rode in a car with someone that had COVID. And even when they later found out after being at the swim school that they had it, when those that they had been in contact with had been tested, it was not being passed on. I'm also a member of the Aquatics Coalition that got formed out of COVID. For those that aren't familiar, that's an organization that has brought together many of the national aquatic organizations from USA Swimming, ourselves, even water polo, water aerobics, therapeutic, all of those organizations together to try to get pools open and keep pools open. And they did a survey as well last fall and found very similar information. They were just not seeing that COVID outbreaks were happening within aquatic facilities. According to the CDC, properly maintained swimming pool should inactivate the virus. They're not seeing that it's being transmitted in pools. Indoor swimming pools are required to have very high ventilation rates to assist in removing the byproducts of chlorine that's added to the water. So what does that mean? That means that the indoor pool area will have the highest air turnover rate and the most fresh air of any other space in that building. We actually talked with one expert that pointed out that the turnover rate in an indoor pool is even higher than the turnover rate in a science lab. Also, another piece of the air handling is reducing air velocity. It's important in indoor pools because it reduces evaporation. From my understanding, the way it was explained to me is so that the air comes down the sides of the walls and then it kind of floats over the pool and rises, so you're not pushing a lot of air across the water to cause evaporation. Well, it turns out that design also helps reduce and minimize the spread of airborne pathogens. Studies have also shown, and I do have some links for those that are like, I haven't heard of that study, because again, it's not information that I think has been put out there a lot, but I did find a couple of studies that mentioned the relative humidity of 40 to 60% could actually reduce the spread of viruses and their absorption through the nasal mucous membrane. So all great reasons to say that swimming in general is probably one of the safer activities that you could choose, even in this time of COVID. And the other thing that we did, and I know a lot of organizations did this for their members, was put together protocols to further reduce the risk of COVID and to follow the CDC recommendations. Things like distancing, wearing masks anytime you are in and around the water. Some took temperatures at the door. Some just had signage out that said, if you've got any of these symptoms, please don't enter our building. So there were a lot of different protocols that were also put in place to try to make sure that everyone was as safe as possible. As I'm sure, again, I know you guys all know this, that we're all about safety. We live and breathe safety every day. And so this was just another way to try our best to ensure that folks were, being as safe as possible. So I'm going to share, this is going to kind of cover some of the points that I made about air velocity, but it's a great fun little video. There's the link to it if you're interested. This was created by Councilman Hunzinger, and it shares some of that great information about air quality in indoor pools.
Particularly in indoor natatoriums, the air that you're breathing in while sitting on the pool deck or while you're enjoying the pool. Most don't realize that indoor pool HVAC units are some of the most robust air handling systems compared to any other indoor space, so it's important to keep them working optimally and efficiently. For many years now, designers have been exploring ways to increase air turnover, minimize air velocity, and introduce fresh air as needed. Indoor pools markedly have sophisticated systems designed to treat some of the harshest air. As far as indoor spaces are considered, the indoor pool area will have the highest turnover and most fresh air of any other space within that building. Pool air systems are also meant to minimize velocity across the surface to reduce evaporation. This also helps minimize the spread of airborne pathogens. Recent studies have found that a relative humidity between 40 to 60% is ideal to create a healthy indoor space and minimize the spread of airborne viruses. Indoor pools are designed with HVAC systems to maintain air temperatures within this range. So, while proper safety procedures must still be followed to reduce the spread of diseases, indoor pools give us a great starting point to provide safe indoor recreation and exercise. And a lot of it starts with the air handling.
Okay, so the next question. So why educate the public and officials? Again, I know a lot of you are already familiar with this, but it bears repeating because I think they're important reminders. So we all know the facts, as I mentioned before. You guys are all experts, but people don't know what they don't know. As we've also referenced, drowning is the #1 cause of unintentional injury death for children ages 1 to 4 and a leading cause for young people up to 14 years of age. Drowning can happen to any family, and it's quick and it's silent. And I think that's, one important piece that people just don't realize. Hold on, there we go. Per the CDC, swimming pool drowning rates among Blacks ages 5 to 19 years is 5.5 times higher than those among whites in the same age group. And removing access to water safety and swimming lessons inherently puts children more at risk of drowning. A couple of thoughts on the risk groups and those that may have more limited access to learning to swim programs. The challenge of, we still have in some states where while swim schools are open, they're at limited capacities still. And, that just means less lessons to go around. And I think makes it even harder for those that may already have challenges getting lessons to find them in their area. So that's, I think, another area or another reason right now to continue to try to spread this message and talk about how essential learning to swim is, to try to get pools back up to that full capacity as quickly as we can. So this is another, we'll try again. I appreciate your patience with the technology here, of a video that was done by Safe Kids Worldwide. It just, again, reiterates what, parents don't know what they don't know.
This is Gary on the street in a pool, and we're asking parents, what's their kid's favorite thing to do in the water?
Jumping in the pool, splashing, gymnastic tricks, cannonballs.
Is going underneath the water to see how long he can hold his breath.
Do you ever worry about your kids around water?
Oh, all the time.
Oh, very much, yeah.
Definitely, yes, especially when there's other kids around.
What does active supervision mean to you?
At least for me and my kids, it means I need to be there and know where they are at all times.
You got to keep an eye on them. You have to be engaged as a parent.
Like really be paying attention.
Never take your eyes off them. You're the mommy lifeguard. You're the parent lifeguard. Know where they are at all times.
And you think that's easy or hard to do for most parents?
Oh, extremely difficult.
It's hard to do.
It's hard to
What are some of the distractions that parents have?
Reading, sleeping,
food and drinks.
music, talking to their friends,
Other kids playing, you hear noise.
playing with their phones.
And what do you think it would look like if your child or any child is in trouble in water?
Wow. I think there's a lot of splashing going on.
Maybe they'd be yelling or crying, obviously screaming.
Would it surprise you to know that a lot of kids, when they're in trouble, are actually very silent and they might not be flailing or splashing around?
Yeah, that would surprise me.
Yeah, that's the opposite of what I would have thought.
It's horrifying to know that is what happens.
Have you ever heard of a water watcher card?
No, I haven't.
No. A water watcher is a card that you can give to an adult, and they will know that it's their job to keep their eyes on the pool and on the kids at all times. And then after a certain amount of time, they can give it to another adult who will then be in charge of watching the pool. Do you think that's a good idea?
Oh, I think it's great. It's an amazing idea.
Oh, yes, that's awesome.
That way we'd know for sure that someone was keeping an eye on the kids.
So where would you get one of these water watcher cards?
I don't know.
That's a good question.
I don't know. Why don't you tell me where I could get one?
Okay, so here again to kind of highlight some of the strategies that you can use to make a difference in your community. Gather those drowning prevention data points and local risk factors. Obviously, I know while Florida has a lot of bodies of water, different towns and cities have access to different types of water. So the more you can gather that information together, make it easy to present to someone who you're trying to convince. They have very limited time and very limited attention span to give to your cause and your what you're trying to share, if you're lucky enough to get an appointment or face-to-face appointment with them. So make sure it's as concise and compelling as possible. Find local coalitions and task force to partner with. For private swim schools, I'd encourage you to take a look at joining our association to join some fellow like-minded swim school owners. But we're finding with this, obviously together in numbers, you can also make more of an impact. The more numbers you have, the more people behind it, the more a decision maker, is willing to give you attention, because you've got you're bringing to them a group of voters that feel that this is important to them. Then that's going to help compel them to take notice and listen. Write those letters to local health officials, government officials, and representatives. Connect with local hospitals and pediatricians is another option. Connect with local schools, educators, and homeschool networks. Also look to connect with local parenting groups, either in person or on social media. And the key one here, like I said, that we learned in working with a group in California, is consider working with a lobbyist, someone with connections to the people in your area that can get you in front of those decision makers and can get you that appointment. We've actually also had a group in New York that's doing something very similar now. As soon as they hired a lobbyist, within the week, they had an appointment with the governor or the governor's office. And they were able to get pools open at 50% capacity in New York State. However, now they're struggling with the city side, and they continue to work with the lobbyist to get the city to also follow what the state has decided. So if anything, that's another thing we've learned through all of this, is that it can be very granular and very local. So while you may want to, it's still important to, I think, educate state officials. It's just as, if not more important, to make sure that your local officials, your health departments, your city mayors, that they are aware of the risks and the layers of protection that are necessary to help this. It's another public health epidemic, drowning, and it's worth attention. Let's see. So here I've pulled together, and again, I'm sure many of you are familiar with this. There was some great information on the Water Smart Broward County website, talking about, especially in Florida, how drowning can happen year round. They're showing you the numbers over time. It does not include 2020 or 2021 as of yet, but you can see the trends. They also talk about the cost of a drowning incident. And I will say that was one thing that the lobbyist also in California used as well, being that they handle unintentional injuries in general. They were very familiar. They even have a few hospital administrators on their board. So they were very familiar with the cost of a drowning incident. And they used that piece as well. I will say, speaking of financial impact, one strategy that we actually stayed away from in California was talking about the economic impact to the actual swim lesson provider. And part of the reason at the time for that strategy was every business was struggling. So if we were to use that message, we were becoming one of many. And so instead, we really took the strategy of focusing in on drowning prevention and the importance of teaching swimming, and stayed away from the financial impacts this was all having on swim schools. But the financial impact, on hospitalizations was definitely one that we did use. Here's some further information and drowning statistics. This one was from myflfamilies.com, and this one was specifically, this one was interesting because, and while this looks like, it's showing drowning in the full pie chart, This one was tracking actually a lot of different childhood fatalities. So these were the numbers to just filter out the drowning incidents. But the other thing that I thought was interesting on this page is that it would actually list whatever, as much detail as it had about each drowning incident, and even include a narrative, which could be very impactful to use. Again, those personal stories and those personal touches of what's going on within your local community, especially when you're dealing with local decision makers. There, you may also be familiar with, there's a group, Total Aquatic LLC, that has been tracking drowning data since 2008. This is their website. They've got, I guess, as comprehensive as it can be. My understanding, their strategy for collecting this data is to pore over news articles from across the country. Any news article that mentions drowning, they read through and work to identify if that if there was a fatality, and trying to make sure that they don't also double count, if there's two different news articles about the same incident. So these are the staggering numbers. As you can see, and I know you all know, Florida's one of the highest across the country. Just want to do a quick shout out to the WaterSmart Broward County. They've got, as I referenced earlier, some great information and are really a great example of an organization that's making some real impacts. And they've got some great information on their website. There's also Safe Kids Florida. That second video was from Safe Kids organization. They have local coalitions throughout Florida, so you might be interested in checking them out if you're looking for an organization to engage and partner with, as well as Florida Drowning Prevention Foundation would be another one to possibly check out. I also wanted to share, we as an organization did also bring together our Florida swim schools. This was back in May when things had initially closed down, to try to put together a letter. You'll see I used the exact example. We brought together other organizations, so it wasn't just our voice, it was multiple voices to, and as you'll see here, added a lot of the data that we've all mentioned and pointed out earlier that you're all familiar with. But this is a sample of the kind of letter that we put together and sent out actually to the governor in May in Florida. Also, I had mentioned earlier the American Academy of Pediatrics. If you go to their newsroom under campaigns and tools, they have an entire drowning prevention section with a lot of data. They've even got some social media posts, some videos, again, material that could be used to help educate. And then I also wanted to mention, I think later today, you'll be seeing a presentation by Stop Drowning Now. They have created a curriculum that can be used in the public education system, or even in private education or homeschool programs. That's all on water safety and drowning prevention. So that's another great resource. And then, as I mentioned before, I'm with the United States Swim School Association. We represent privately owned swim schools. We have a variety of resources. And if you are a private swim school, we would love to chat with you further. Hopefully you would like to join us and the like-minded folks within your state. We do a variety of member benefits, both to help the swim school run their business, hopefully a little better, and hopefully save them a little money, but then, as you see, trying to help spread the water safety message and help prevent drownings. So together, we really can make a difference. It takes a lot of work, it takes a lot of patience, but it can happen, which is exciting to see. So thank you. Are there any questions that folks want to put in the chat? And I was going to say, I did see some requests for video links and all of that. Yes, if you want to email me, I am happy to share this PowerPoint. It'll have all the links within the PowerPoint.
It's not doing anything.
Perfect. Thank you so much, Lisa. Sorry for our little extra guy, but thank you.
Yes.
The joys of online and everything. My husband's on the other line with, so I get to be with my little guy. Anyhow,
I love it.
Does anybody have any questions for Lisa? Everybody good? Thank you so much, Lisa, for giving the information and being part of the spearheading of making swim lessons essential for in California. That's huge. I have family that's
we were hoping that once it hit California that it would kind of go across to other states, but it takes a lot of local effort. That's the other thing we found. It's you can't really do it on a national level. It's that local.
All right. Well, thank you. And is this started in Florida yet? I know that we with the YMCA, we're doing swim lessons. I think it was it depended on the swim lesson I'm so sorry, depended on the facility if they were going to be opening for swim lessons or not. And so, yeah, we've been, or at least for the Y, we've been open for many months.
Yes, and I know there are many swim schools. My understanding is Florida has been pretty open, except for maybe the Miami area. And I think because of that, I'll be quite honest, there hasn't been as much of an urgent need to get learning to swim deemed essential in Florida because you guys were open. But like I said, I think it's worth taking a look at and worth bringing a group together to really try to make it happen.
So there's a question, James wondering advice.
And I don't know if she froze for everybody on overcoming the 6-foot social distancing and no mask in the water requirement. So many of our swim schools have been using the face shield. I will say we have had some schools, especially depending on your community and how sensitive they are, that have done both the face shields and the masks while in the water. I will say we had some conversations with folks at the CDC, and we were asking them about that requirement of saying no masks in the water. We said, well, what about a swim instructor that can stand in the water? And their comment was, yes, we had a similar conversation with the lifeguarding groups and decided it was just too complicated. So we just wanted to say, don't wear a mask in the water, because their number one concern was they didn't want you to drown wearing a mask. So with that knowledge, if we have had some swim schools, I don't know that it's many, but we've had some that their staff does wear a mask. They'll have extras on the side of the pool in a baggie to keep dry. So if it gets wet, they can swap it out. But many of our schools have been successfully using the face shield for the swim instructors, and then being able to touch the student, for safety reasons. Obviously, they have modified their lessons so that they're maybe not as much face to face, like looking in their face. They may put the student more off to the side rather than in front of them. But they are still touching the students while wearing the face shields. And I see, Jenna, we're currently doing swim lessons. I know it was just discussed for the possible future lockdowns. I mean, yeah, another reason I'm reading articles about second strains in different versions of COVID that are floating out there, and some concerns about that. So again, another reason that it would be worthwhile to bring a group together to try to be sure that learning to swim is deemed essential going forward. And a question if we're doing group lessons or just privates. I've seen both. I think in our last survey that we did with our members, I think for the height of COVID, most of them were only doing privates. I would say about 35-ish, 35% have gone back to group lessons, but many of them were still doing the private lessons. And some of that now, as things are getting to reopen, depends on your community. What is your community comfortable with? You know your customers and what they're going to be most comfortable with. We've had some that have left the private lessons where they're at and have just added in some group lessons. So those that like the privates can stay with it, but then those that are ready and more comfortable with the group lessons, can sign up for those as well. George says he cut down in class 6 to 1 for a class, learn to swim level 1 and 2, ages 6+. So thanks for sharing that information on your lesson. So yeah, a lot of it I think just depends on, your community, also your local rules. As I've mentioned, I heard Miami was all along more strict than the rest of the state. So make sure you know what your county health department is advising, and then do what you can to also then help educate them on why you feel it's so important to be open and to be serving the members of your community with swim lessons. I'm not sure. I think we might have lost Libby with her connection. So, oh, yep, yeah, she lost internet. So, thank you everybody for joining today. It was a pleasure to be here. I appreciated the invitation. Thanks everybody.